There are many reasons people undergo plastic surgery. They might want a facelift or even a tummy tuck. But for some, plastic surgery is not just a matter of choice, it's a last resort. And at the Center for Plastic and Cosmetic Surgery in Willoughby Hills, that plastic surgery is often a life-changing event.
I never thought plastic surgery was an option for me. I always thought that, if I'm going to get rid of all this excess weight, it's going to be through diet and exercise, even after the bariatric surgery.
Tracy, who prefers to remain anonymous, lost 130 pounds after that surgery 2 years ago. But even then, there was still something wrong.
From my waist below, I just had a lot of hanging skin, and no matter how much exercising and dieting and lunges, and it just wasn't going away. It just hung.
So Tracy visited Dr. Gregory Fideli at the Center for Plastic and Cosmetic Surgery in Willoughby Hills. And soon after that, Dr. Fideli performed an abdominoplasty on Tracy.
She had a type of body contouring procedure in two parts. One was liposuction, which helps to remove some excess fat in areas, and also she had a lifting procedure that helps to lift the lower body and remove the extra skin that she has because of the weight gain. The lifting procedure is really the only way to remove excess skin.
I'm still pretty swollen, but they took off 29 pounds of skin and fat. But until I got dressed to leave the hospital, I put on the sweat outfit that I wore to the hospital. And if I didn't have these drains and the bandage, they wouldn't have stayed on. And I just started crying. I was so excited because you have no idea.
The biggest myth is that plastic surgery is for the rich and famous. Plastic surgery is not as costly as people might think.
Dr. Fideli says his typical patient these days is, well, typical.
It's more everyday people, common people that have regular jobs that want to enhance their appearance, want to look better or restore something that was lost due to pregnancy or weight loss or weight gain.
Dr. Fideli says his role as a plastic surgeon involves more than just technique.
I am an artist. I've been doing medical illustrations and have published a lot of medical illustrations and textbooks. And I think that as an artist, that artists do see things differently.
Dr. Fideli believes that technology and art are intertwined in the specialty of plastic surgery.
I think that a plastic surgeon has to approach somebody almost as a painting in what I'm going to create. And the difference is that a person is not a white blank canvas. They do have some form or structure that you're beginning with.
As such, Dr. Fideli says there is no cookie-cutter formula in his work.
I think it's very important to individualize every procedure, whether it be something like liposuction or something like a rhinoplasty or a facelift. A reason that they want to have the procedure done, and it may be just to feel good about themselves or to try to get an edge on younger competition, or maybe to have what they once had prior to pregnancies or something like that.